All right. So the first time that I went live, I did a brief introduction, but Dr. Parson was not here. So I do want to introduce Dr. Nicole Parson. She is an obstetrician gynecologist. She works with Bradford Clinic, located in Charlotte, North Carolina. And I was mentioning too that you guys are in a couple different locations. I know for sure Matthews and I think Valentine, but I also wanted to give you an opportunity to introduce yourself and tell everyone about you and what you do.
Okay, so I'm Dr. Parson. As Dr. Covington has already said, I am a part of the Bradford Clinic here in Charlotte. We do have 3 office locations, one down at Prescribe, Maine, right across the street from the main hospital. And then we have a location in Valentine and a location in Mass. And I do in those South Charlotte, Valentine, and in Mass.
So a lot of locations. That's awesome. So for people in Charlotte, you have a lot of opportunities to see Dr. Parson throughout the city. So just to kind of start from the foundation, our topic is PCOS, but I want to talk a little bit about what is an OB-GYN doctor and what type of things do you do. So can you explain that?
I sure can. So I am a specialist in women's health. We specialize in taking care of women from the onset of puberty in most cases, and for the remainder of her life. And that can be anything from her menstrual irregularities to childbirth or pregnancy, attempted pregnancy, and then into those years where she's going through menopause and may have symptoms that need to be managed. We also do quite a bit of primary care in terms of preventative annual exams and screening tests annually.
Okay, well that's awesome. So let's just jump right in. So polycystic ovarian disease, it's a term that a lot of women have heard and a lot of men as well, but we're just going to start with the basic definition. So what is PCOS?
So PCOS is a condition that is referring to the abnormal hormonal output of the ovaries. The way in which I describe it is, when I talk with patients, is that the ovaries are an organ in your body that releases hormones, and they do that in a cyclic fashion. It's very much, I think of it like an orchestra. It's supposed to play loud, and then there are times when it is supposed to play low. And it is that variation up and down that sends other signals throughout the body for ovulation, for your period to come, the body temperature, etc. In PCOS, for whatever reason, the ovaries are not getting the memo, and they are playing loud every day, all day, and we never get that fluctuation in hormonal release. And when that happens, you get a lot of abnormalities that release, and it's those abnormalities that will typically bring women into PCOS.
Okay. I like the analogy of the orchestra because that makes sense to me. So there's times when your body's supposed to be doing stuff and secreting things, and then there's a time where it's supposed to be calm. But it sounds like for PCOS, it's playing loud all of the time. So what are some of the abnormalities that a patient with PCOS will experience?
So the top things that women would come in for, number one would be period irregularities. And there's 2 main complaints. Either I've not seen my period for several months, and in some cases years, and then the very opposite, which is that I bleed all the time. So menstrual abnormalities would be number one. Hirsutism, that's when women had noticed that they have increased acne or hair growth, and that hair growth is oftentimes in a male distribution pattern. That might be increased hair on the chin, the upper lip, the chest, and then your normal areas, arms, legs, etc. And then a couple of other reasons that patients would see that their symptoms would be infertility and inability to get pregnant. And then last, pelvic pain.
Okay. All right. that's actually one that I wasn't aware of. So they can have some discomfort in the pelvic area as well. Okay. So how would you diagnose this?
So the diagnosis for PCOS is what we in the medical community call a clinical diagnosis, meaning when we see you based on symptoms, I can diagnose you just based on symptoms. So that's a common misconception that you use labs to diagnose, but you don't. If you have a woman who has what they call hyperandrogenism, which is increased male, hair distribution or acne, coupled with menstrual irregularity, abnormal periods, that is enough to diagnose a woman with PCOS.
Okay.
You will also see in the workup, it varies from physician to physician, ultrasound to look at the ovaries, so you can see many cysts on the ovaries. And then sometimes people will do labs looking at testosterone and other hormonal markers.
Okay. So what is the typical age that a woman will experience this? Is this a young adult issue? Is this a right after puberty type of thing? What's your opinion on that?
So interesting enough, I think that the age is actually decreasing, and that's just my clinical opinion based on my patient population. One association with PCOS is obesity, which I'm sure you will be getting to that.
My favorite topic.
And so, because obesity in this country is rising, then PCOS and the incidence of it is rising. And because we are seeing obesity at earlier ages, that I'm seeing patients with these symptoms at earlier ages as well. Absolutely. And so you can see a young girl, 16 years old, and then definitely up into the late 30s, I would say would probably be that age span that most patients that I'm dealing with PCOS are.
Wow. Yeah. So a great segue, and you bring up a great topic. So I do see quite a bit of PCOS in my clinic because of the obesity. And then sometimes I see them for infertility. Of course, I don't directly treat infertility, but infertility doctors will send their PCOS patients to me because the first line treatment, and we'll talk about treatment more, is actually weight loss. So 50 to 60% of patients with polycystic ovarian disease actually are overweight or even obese. And that brings up a great question. And I'll just go ahead and say that I don't think anyone has the answer to this question, but it's a question I get very often. Patients will say, did I develop PCOS because I'm obese, or did the obesity cause PCOS? Was it, which one came first, the chicken or the egg? So I do want to get an expert's opinion. My answer is typically, who knows? They both can drive each other, and we don't typically know which one. However, what does Dr. Parson think about that?
Same thing. Number one question that I get as well. And my answer is that we don't know. Probably there are clinical scenarios in which both are true. What we do know is that they travel together. And so I have seen patients who have a normal BMI who have come to me for infertility, and I've diagnosed them with PCOS. And at that time, I counsel them then on their increased risk of developing obesity, developing cardiovascular disease, diabetes, etc. And then, the opposite is true as well. Often patients who are overweight, and my number one differential, my number one suspicion is that they have PCOS. And so I think probably they run together, and both are probably true.
Yeah, and I would agree with that too. So let's talk a little bit about treatment. So for a patient who comes in and you've diagnosed them with PCOS, what would be the first thing that you would start with for treatment?
Number one thing, weight loss. I tell them that, and it's the hardest thing because it's the one thing that we all wish we got right. I think every woman in America would love to be more healthy and lose weight. And so, that conversation is always difficult because it's somewhat discouraging, but it is the truth. And so I tell patients that if you are to really improve your symptoms is through weight loss, and that you won't ultimately lose if you lose weight. So diet and exercise is the number one way. So the very first thing we qualify as counseling to do with is weight loss, and so specifically through that and set goals for that. The second thing for treatment, my treatment is always dependent on their symptoms. So if I have a woman who has come to me and her symptom was hirsutism, then there are medications that can help with that. There are certain birth controls that help decrease the hair growth. Spironolactone is a medication that is often used as a diuretic and works in general medicine population, but it also has anti-androgen properties which can help improve one's symptoms. And then, laser hair removal and etc. If someone's coming to me and their primary complaint is infertility, then we have to normalize their cycle. And so for them, birth control might be a temporary solution to help regulate, but then ultimately we're wanting to help with their ovulation, maybe clonus, or increasing that ovulation rate. And then for those who have irregular menses, then again, birth control is our staple for regulating their cycle.
Well, awesome. Well, I can tell you for the weight loss piece, there's actually been a lot of studies in PCOS and weight management, which is surprising because there's not always the traditional medicine studies with weight management. So one of the things that has been found is that typically at any time, 85% of our PCOS patients are actively trying to lose weight. And what's unfortunate with PCOS is that it's extraordinarily difficult. One, because of the hyperinsulinemia, and we know that insulin not only drives the androgens and those male hormones that may cause infertility, but insulin's also a hormone that stores fat and increases cravings. So you have someone who is trying to lose weight and then they're battling this physiology. So what I find with the PCOS folks, a lot of them are also exercising, and surprisingly, some exercises will lead to more weight gain, especially for this population. I always mention a case when I talk about PCOS of a patient who gained 11 pounds in a week. One, they were using the wrong protein, but they were also doing really rigorous physical activity, the CrossFit and the things that we tend to think would really work for majority of the population. Why does it not work so well for PCOS? Well, the thought is that they have testosterone. So they have a lot of unopposed male hormones, and that is building additional weight that is, leading to them being more discouraged. So I can tell you what has been shown to work for PCOS. Of course, we can use any of the FDA-approved weight loss medications. Bariatric surgery has been used. But even before you get to the more extreme options, when we look at diets, the best diets for PCOS are the lower carb and ketogenic diets. And it's because of the insulin, the high carbs. When we take those out of the diet, we tend to see more weight loss. And that's also the idea behind metformin, some of the idea behind metformin. Metformin helps to sensitize the insulin, and it helps with some weight management. And it also helps with the anovulation and the infertility, because you're bringing that insulin down, and now the body's starting to work properly. For people who have a really difficult time with diet, meal replacement has been found and studied and proven and documented to work really well in PCOS. And I emphasize that because a lot of times we don't do those type of intense studies for meal replacement. That's just the truth. But it has been done in PCOS and shown to cause some weight loss. So with a meal replacement program, these are prepackaged foods basically, so it's convenient, it's easy, your protein, your carbs, your calories, your portions are all controlled, and it's something that somebody can just start on day one. Now, it's not extraordinarily easy, but after the third or fourth day, people tend to do well. And it can be pricey because you're replacing all of your meals, but that is a way of handing somebody a ketogenic diet, basically, or a low carb diet. So we see weight loss with that. So do you prescribe a lot of metformin for your PCOS patients?
So I do. No, I wouldn't say a lot of my patients, but I think that there's a subset that is definitely appropriate for. The patients who do have that obesity component to it, they do have elevated lab values that say that they are approaching a diabetic status. And then those who are having trouble with infertility, those would be the main patients that we actually use metformin.
Okay. So, you know, the last thing I'll say with weight loss, what I see commonly is whenever people are doing a weight loss program and they're a woman of childbearing age, we do a lot of pregnancy tests because they end up pregnant. Just all the hormones are working better. So that is a really good, well-rounded discussion on PCOS, kind of hitting some of the highlights. We kind of started talking about signs and symptoms, diagnoses, treatments, weight management, which is always a huge topic for PCOS. This is actually one of the topics that my patients requested. So we did a poll a couple months ago and asked people, what do you want to talk about? And this was one of the top things that they wanted to discuss. So it's a huge treat to have Dr. Parson here. I will give about a minute, well, let's see, 20 to 30 seconds for questions. If there are questions in the chat, you can ask those now. If you have questions for PCOS, that's preferred. However, if you have a general women's health question, we can take those as well, or weight management questions. Okay, so is PCOS something you are born with or is it developed? I don't know much about it really. So what do you think about that?
So it's acquired. And the reason for that is because when we're born, we don't really have a lot of ovulatory function. The ovaries don't really come alive, if you will, until we're approaching that puberty. And so how they ultimately will function will not really be realized until you're going through puberty and after. So no, it's not something that you're born with. Okay.
And then our last comment was, thank you, Dr. Parson. So, all right, so we're going to go ahead and close. Dr. Parson, again, is an OB-GYN doctor. She's at Bradford Clinic. She's accepting new patients. She's located in a couple different locations. So look for her in Matthews or Ballantyne or South Park or Uptown. And I'm really excited to have her here and to talk about this really important topic. The last thing I wanted to mention, we've been talking a lot about women's health for the last 2 weeks. However, tomorrow starts Men's Health Month. So I will be giving a lot of attention to men's conditions. I don't want men to feel left out. And I will have a special guest mid-June to talk about men and actually give some weight loss tips specific for men. So thanks everybody for joining in, and that's gonna conclude this topic. Good night.
Thank you.